Well, thank you so much, and thank you, Tom, for your encouraging words, and thank you, Ramya, for your presentation. We are very grateful that both of you could join us today and give your presentation for this webinar series. So at this time, our speakers will address your questions and comments. Please submit your questions using the chat feature in WebEx. Questions are being compiled, and Ramya and Tom will address as many as time allows. So while questions are coming in, I thought I'd like to come back to the data issue that both of you actually have raised and that we've actually talked about in preparation for this webinar. You know, what is the role of researchers and epidemiology researchers in particular to address this data gap? When we had first met, Ramya, you had mentioned that, you know, very often in epidemiological research, perhaps, oftentimes the information is not necessarily stratified by the various factors that we might be interested in terms of indicators of susceptibility and vulnerability. I was wondering if you could say a few words about that.
So I think that's a really important question, Devin, and I think it's important to note that we tend to think a lot more about kind of the front end of research, so that there needs to be more studies and better studies, and of course this is true. We all want more and better studies, but there's also this kind of back end of research where there are other things that we can do with the research that we already have in order to help make sound public health policies. And when we did our systematic review, we identified around 40 studies that looked at SES as an effect modifier of lead toxicity, but the majority of these studies simply didn't report the types of information that would be really useful to people interested in doing susceptibility research. And so often studies would, for example, indicate that they ran interaction effects in their models and they didn't find anything significant, and therefore they didn't report any of the effect estimates. And we ended up including these studies in our review, but even if the effects aren't significant, just knowing the magnitudes would still be useful for us, particularly because many of these studies are underpowered anyway to detect a significant effect in a subgroup. But compiling this information starts to give us an idea or a frame of reference for thinking about how large subgroup effects might be. And it would have been like extremely time and resource intensive if we were to contact every author and ask for their data, and many studies were old and I didn't want to spend another 7 years on my dissertation. So we just went with the studies that actually reported subgroup estimates. And so my point is that there are efforts that can be made in these areas of data organization, management, and reporting that would be extremely helpful to getting policymakers access to the type of data that would be directly relevant for crafting programs and policies. And I know these things, you know, aren't really sexy, but I actually believe they are crucial to cumulative risk assessment, which requires a lot of information. And so we need the types of tools that can allow us to easily access and organize and then retrieve the useful data and use them in various analyses. And so it's not just about doing more research. It's also about really trying to better to get a handle on the work that we already have done.
Thank you so much, Ramya. You know, listening to you there made me think about the number of initiatives recently that are underway around health disparities, and you know, at the federal level as well, and research support that is being provided by HHS. And I'm wondering if you know, there might be an opportunity here to sort of bring these interests together. Clearly there are these researchers and public health practitioners who are focusing on minority health issues or health disparities, who probably, you know, are able to collect information that would be very informative to this discussion around cumulative risk and the issues around susceptibility and vulnerability. And like you're saying, you know, how can we make better use of information that people might be collecting already right now. I want to go to our chat box. We have a few questions in. So, okay, this is for both of you, and Atal and Ramya. How do you see advances in toxicology around epigenetics informing cumulative risk? Otherwise, or such as understanding broader health endpoints or system effects as opposed to specific health outcomes?
This is Tom. Can you hear me, Devin?
Yes.
Okay, so this is a really important question. So just last week I was at a conference put together by EDF that looked at EPA's work in computational toxicology and the future of toxicology with high throughput tests that are really going to open our eyes to issues of mixtures and to upstream endpoints that will really give us a lot of new information, not only about thresholds, but also about potential cumulative impacts. And when we think of the range of data that may go into a cumulative risk assessment, from those very fundamental changes and indications of cellular and subcellular and genetic impacts, all the way to the evolution of health impact assessment to better understand community health impacts of our environmental decisions, we really have to consider the full range. So this is an extremely exciting time in terms of cumulative risk, because all indications are the substance by substance approach is being changed to health outcome, adverse impact, systems approach, and we have to think through the entire continuum. So I actually think there's great promise in the evolving toxicology of our short-term tests, of our computational tox approaches, to understand the relationship between those signals, those perturbations, those systems, and those health impacts in the populations. And I think our challenge now is to see how we will build the case for how we prioritize susceptibility through that, and how we prioritize health endpoints in our decision-making process. But I think that's an important question, and we need to begin to connect the dots, because I think many of us kind of see through the lens of our individual disciplines, but this is going to have a tremendous impact on our ability to rank order and make better decisions about those kinds of environmental impacts that we're trying to prevent.
Mm-hmm. Ramya, do you have any thoughts you want to share on that?
Well, I just want to piggyback off of that and add that one of the challenges, though, in terms of moving across this entire continuum is making sure that that there is actually support in order to do that, because it can be very easy to say just kind of focus research in one area and more on, say, the intrinsic susceptibility characteristics and the genetic side of things, and not so much on the more acquired susceptibility characteristic side. And so it would be nice to for like a funding agency to have a good model of what exactly their research questions are and what they actually, their goals of the research is across an entire spectrum, so that researchers are allocated across that entire spectrum and not just concentrated in one area.
Okay, thanks. Another question or comment here. The Silver Book 4-step procedure seems oriented towards a cumulative risk assessment that begins with some identified stressors. Can it be applied to a cumulative risk assessment that is initiated by a real or perceived increase in a disease rate?
Yes.
Short answer.
That's a challenging question. Obviously, now as we take on some of the really difficult evolving population health issues that may in fact have very important environmental contributing factors. So if we look at the challenges of apparently more and more neurodevelopment issues in our children and in future generations in youngsters, whether it's autism or other neurological development issues, I think it's really important that we have this tool of cumulative risk assessment to put the contributing factors, to put those things that contribute to risk, and to understand population baseline so that we can make better decisions about the potential regulation of neurotoxicants, about prevention, and about our intervention strategies. So I think if I understand the question is about can we use baseline population epidemiology to kind of shape our strategies? Yes, and I think that has very much, if you think of the model, and perhaps it got us maybe focused on one input in excess in our work in environmental protection through the 70s and at least the early 80s when we focused on cancer prevention. But now as we look at the realm of potential endpoints that we are concerned about, from endocrine disruption through immunological impacts through neurodevelopment, we can very much think of population health and the endpoint as providing us with the starting point for the conceptual framework for the cumulative risk assessment.
I have a question for Ramya. They say thank you for your offer of providing references. And she wants to know if we could, I guess, share those with the folks on the line here. And yes, we can. And so we'll follow up with everyone on that. On your study, Ramya, another question is, please indicate the SES model used, the parameters and weight in the SES parameter. There are several SES possibilities. So maybe they're asking a little bit more about exactly how you were able to, indicate the SES in your model.
Oh, the measures used.
Yeah.
So we had them in low, medium, and high SES, and the studies. So I'm blanking. So we took them directly from how the original studies measured SES, and unfortunately, I'm not recalling off the top of my head exactly how each of those studies ended up measuring SES, but I can definitely get back on this question.
We can add that perhaps when we include maybe listing out of the references. Okay. Here's another one. Thank you for a great presentation. Just to make it clear, are you recommending to consider non-chemical factors at the dose-response assessment stage? This is for either one of you.
Okay, this is Tom, and if you look at the Silver Book framework that tried to think of what kind of model would I put together in dose-response assessment, well, obviously you need the kind of traditional approach to understanding with increasing dose or increasing concentration how the probability of the adverse outcome is affected. But for the cumulative risk assessment, yes, we are considering, as you put together your modeling approach, that there be consideration of those other factors that may change that dose-response curve. And so if you follow that through the diagram and probably my fifth slide there, we are considering that as we present the data, all right, now there will still be kind of the traditional approach to the dose response, but we also need to, just as Ramya has shown in her work, consider the susceptible subgroups determined by those factors that may influence that dose response curve, and that will better inform decision making. Now, this doesn't, one thing that I want to kind of make clear, that this doesn't mean that as we have multiple dose response curves influenced by baseline exposures, other exposures, and we think of ways to model this, that will necessarily drive us to more regulation, it will necessarily drive us to selecting a much steeper dose response curve. Rather, I think this drives us to consider a much better characterization of risk put in perspective to guide the decision process.
All right. I have another question. Current practice, I'm assuming with regards to environmental protection, environmental regulation, current practice is to focus on reducing exposure to the extent feasible and as technology allows. In the future, are you suggesting the focus may have to be to shift towards modifying or reducing the vulnerability or risk factors instead of reducing pollution?
Why not both? I think the part of the some of the positive benefits of cumulative risk assessment is that it opens up the range of interventions that can be considered. Instead of only having to focus on, one side of the coin, we can now consider a range of different options. And so it's not saying that we need to do this and not the other, but now we can have a range of options to consider when we're trying to make decisions.
So I'd like to take a little bit different spin on that. One is cumulative risk is not really, the purpose of cumulative risk is not to rewrite our environmental statutes. There will always be a need to control pollutants, and there will always be statutory mandates that will require us to set standards for specific pollutants. I think what cumulative risk assessment does is provide a context of the relative contribution of that risk to the big picture of the population, but more important than that, particularly in terms of today's discussion, to really consider the susceptible populations and how we might best protect them. So that I don't think this is about EPA suddenly taking on a crusade for better socioeconomic status for all inner city kids, but rather to understand good regulations, good interventions can be guided by a better understanding of the full public health picture of reducing risk. And in some cases, it might mean that we don't approach those very specific individual risks because within the big picture, it may not lead to measurable benefits or benefits that are deemed to be acceptable. So it cuts both ways. But it's not about rewriting the environmental statutes. We will always have those mandates, and EPA's goal will be to protect the environment and public health and therefore regulate individual risk factors that may not, by a long run, be the greatest risk factors for a particular health outcome.
All right, I have another question. It is well recognized that lead is a non-threshold chemical for non-cancer effects. Such a trait is not typical among chemicals producing non-cancer effects. The data largely supports thresholds. Given this fact and that most animal studies are at higher doses than actual human exposures, how do you envision the construction of dose-response functions that estimate the non-cancer risks to chemical exposures in susceptible humans?
Okay. Let me address the first issue of thresholds, and because the National Academy panel really spent a lot of time thinking about this, and again, going back to that figure of the individual threshold versus population threshold, I'd like to address that. And yes, there may be on an individual chemical approach and within an individual study, there may be evidence of thresholds. We found that there is not overwhelming evidence of thresholds for many chemicals, that we really don't have the data to show that we've proven that below a certain level there is in fact a threshold. It's one approach to that. We therefore recommended putting in the perspective of the population, the total population exposures, including the susceptibles, and calculating risk in a way that we can understand the incremental risk at different doses. And so while we recognize, yes, there may be thresholds, once you understand the biological factors within the population, the range of biological susceptibility, the range of baseline exposures that bring us up already on that dose-response curve. We are not laboratory animals in a clean environment. There's lots of existing risk factors. You just think cancer alone. A third of us are going to get cancer at some point in our lifetime. So there's not a really good population threshold for that. So incremental risks above that, we really feel we have to consider the cumulative impacts. And I hope this addresses the question somewhat.
All right. Dr. Burke's suggestion that cumulative risk assessment may rely more on characterization rather than quantification would suggest that the decisions this would inform might not be those that risk assessors have traditionally approached, like standards for chemicals in the environment relating to, permitting. Could you say a little more about that sort of decision that lesser quantified cumulative risk assessment might inform?
Sure. So I actually was involved in lots and lots of permits in a former life as a regulator, and where there's incomplete data, but there's a need to protect the whole population. And unfortunately, very often we don't have exact data to relate to a certain incremental risk within the population of concern. So the permit process should be informed, first of all, by an understanding of other sources in the area, the total contribution, and certainly when we're thinking about the Delaware River and impact through the NPDES program of the susceptibility of that river, we think about things like this: what's upstream and what's the incremental addition from new things coming online or new permits. And so I think that from an ecological perspective and a permitting perspective, we have used this approach of trying to understand the broader context of how we write this permit. And so when I said we're not going to get to individual risk assessment numbers, perhaps answering all the questions, there will still be the need for that individual risk assessment. So as we think about a Superfund cleanup, we'll try to think of a range of acceptable risk, but hopefully we will think this first within the context of the mixtures of multiple exposures, and then secondly in the context of stakeholder views about risk and the health of the population. I know this is a new mindset and it has a qualitative aspect to it, but I really think that we're evolving past the just 1 in a million number or some bright line into a more qualitative, public health guided approach that will put things in perspective and better assure us that our environmental decisions are actually having a benefit.
Well, similarly, I have another question for you then. Even though we are now exploring susceptibility, how do we get around the sort of one-size-fits-all approach and account for differential locational characteristics of cumulative exposures?
That's a great one. There will always be disparities. There will always be disparities in the health of the population. I'm sitting here in East Baltimore that has a mortality rate more than twice of many other similar areas and similar neighborhoods. Even within Baltimore City, we have tremendous differences. Some of that is environmental. Most of it is socioeconomic and other factors. So that I think we have to be aware of that as we make decisions. We're not going to avoid that question. One size fits all that says, for instance, in the case of lead, that this concentration is the way to go with everyone. Well, that has been an approach that has served us well. But frankly, if we're going to adapt to evolving science, whether it be on the molecular level or the population level, I think we need better characterization of risk so that we can be informed when we make those decisions. And
actually, so I was thinking about kind of these issues the other day, and Tom, I would love to hear your thoughts on this as well. But when I think about cumulative risk assessment, I feel like CRA is really more related to what other fields might call scenario-based planning or capabilities-based planning, or in this case, it could be called environmental risk management-based planning. And so perhaps the output for CRA could be something like 15 to 20 different risk scenarios. Like, it's a much more flexible decision process where you don't have to choose just one critical health endpoint or just one vulnerable population, or maybe even just one exposure pathway. You can consider a range. You can rank scenarios. You can try and get at worst case and reasonable case scenarios in a way that's transparent and open. And it's a way to get at uncertainty that can also play directly into your risk management options, because then you can consider options that might cut across a range of different risk scenarios, or that might just target a few.
That's a very good point. I'm just being mindful of time. I would like to take just 2 more questions, and we'll see how that goes before we close out. Sort of kind of picking up from where you were just leaving off, Ramya, we have a nice question here about, could either one of you say more about what you would borrow from ecological risk assessment processes in terms of cumulative risk and human health impacts?
Ramya, you want to try that, or want to give it a shot?
Yeah, you should. I don't have that much familiarity with ecological risk assessments.
Okay, so one thing, and I mentioned this, we had ecological risk assessors on the Science and Decisions panel, and they were tremendous in kind of giving us a perhaps more qualitative, but certainly a more problem-driven approach. And I think our health risk assessment has been very much driven by epidemiology and toxicology and dose response curves, whereas the ecological approach has been, we have this system and there are multiple stressors on it, and our goal is to help preserve or improve this system. What are the things that we can do to manage those risks? And sometimes that's permits upstream, sometimes that's putting limits on discharges, and I think that's a risk management driven approach in many ways that really gets to the whole issue of what are we trying to do here. So we can very much learn from that overall approach. Similarly, if we're thinking about making decisions that impact the population, and we know that we have certain legal mandates concerning air, water, and waste, how can we make better decisions knowing the vulnerabilities of that population, knowing the things that they're most concerned about from a public health perspective, knowing their health status, and knowing what the potential incremental risk might be from these either new sources or new decisions, we can do a better job at making those decisions. Now, I know most people listening in are people who work within a regulatory agency, and they're saying, well, Tom's being really academic about this, and this sounds wonderful, but we have to write standards, and we have narrow mandates. And believe me, I totally understand that and have done a lot of substance-specific risk decision-making. But I also am very optimistic that that will always be a part of the informational process that goes to the decision makers, but better decisions can be made when we understand within the public health context, within the ecological context, the overall stressors that contribute most to the outcome we're trying to prevent. And it will force us from this kind of numbers-driven approach back to better solutions.
And I think I would like to just round out this Q&A session with this one last question for both of you. There seems to be several future needs here to get at cumulative risk assessment. Can you pinpoint any major priorities, I guess in your opinion, in terms of data collection and computational needs? Your laundry list.
Oh boy, Ramya, you start with epidemiology and the need for information there from your study, and I'll add.
Okay, well, I mean, obviously the focus of my talk was on susceptibility, and I think there is definitely a greater need for, I mean, not just, as I said earlier, on the back end of being able to use the data that we already have in a more meaningful way, but to also invest resources into doing epidemiological studies that can really assess some of these subgroup effects, and so looking at effect modification of SES, or going even lower into trying to figure out what the different pathways might be that could lead to differential effects across socioeconomic status. And so there's a lot of research going on right now on things like stress and diet and nutrition and disease states, but again, many of epi studies suffer from having low power to actually detect subgroup effects because the studies aren't actually designed to do so. And so that would be one area of need that I would point out, studies that are constructed specifically to try and get at issues of susceptibility.
I would echo that, but I'm going to talk about kind of a radically different approach to this. First of all, if we're going to move ahead with computational toxicology and trying to move from there upstream effects, we're going to need a lot more information about exposure, but we're going to need investment in the human studies to understand, well, what is the actual impact in the population and how do we validate this approach? And so human health effects research is more than just the tox studies. We really have to invest in observing the health of the population more than we do. All right, and that will mean partnerships, that will mean understanding community health better than we do. But I'm going to suggest something radical, and that is, if we want to do cumulative risk management better, we really have to perhaps have some studies that take a look at the things that we are doing to see if they're actually having an impact on cumulative risk, to help us determine how our policies are working. And this was one of the emphases of the new framework in the Silver Book, to have an iterative process that said, okay, we've made this risk decision, but did it work? Let's go back and look at it within the context of cumulative risk to make sure we're making the best decisions. So I think we need risk management evaluation as well to help guide us in the future.
Thank you so much. That's excellent. This concludes our webinar and our speakers, and I want to say thank you so much to Tom and Ramya for your presentations today, and thanks to everyone for their participation. I just want to call up a couple extra slides real quick. I'm pleased to announce that the Cumulative Risk Assessment webinar series will continue through 2013. And showing on the slide now will be the speakers for our February webinar, which will be held on February 27th at 3 o'clock. And will feature presentations from David Degenian from the Barry University School of Law and Nick DeLuzio, a GIS analyst and project manager at Newfields in Atlanta, Georgia. And they're going to be talking about patterns of pollution. It's a project that the two of them worked on together. Perspectives from an environmental attorney and a GIS scientist on the identification and assessment of environmental justice communities. And again, because we're going to have two speakers, we're going to extend the time to 4:30. But on the next few slides, I'm just going to show you, if they could advance the slides, just stay there for a second, to show you speakers that we have coming up over the next 6 months. So we really do take your comments into consideration when folks fill out the evaluation survey in terms of topics people want to hear. And so we are very happy that we have several people lined up. So in March, we have Dr. Douglas Crawford Brown, who will be speaking about the topic of cumulative risk in drinking water. Many of our presenters have talked about cum risk with regards to air pollution, and I thought it'd be really great to talk about it from a different perspective, a different environmental medium. You've heard Tom mention Jonathan Levy, and Dr. Levy will be joining us in April to give a presentation on his work. He's actually one of our STAR grantees on cumulative risk, so he'll be giving an update on his work under that project, looking at some statistical methods for assessing cumulative risk. Could you advance to the next one? Thanks. And then we have several others lined up. We heard from folks interest in hearing more about cum risk from the ecological perspective, so we have Dr. Glenn Suter lined up for May. We have another one of our STAR grantees on cumulative risk presenting in June, Dr. Chan. And then we have in July Dr. George Alexif from California to talk about their project on developing a cumulative impacts methodology. This has been very famous. I think most people, frankly, on this call probably are aware of what has been going on in California, and he's going to give us an update on that methodology and how they are applying it. And then in August, we have another EPA STAR grantee on cumulative risk presenting, Dr. Stephen Linder. So again, I want to thank you all for your participation. Thank you, Tom. Thank you, Ramya. And
thank you.
Yes, and as a reminder, everyone, you will receive an email invitation to complete our online survey about today's webinar. Please take a few minutes to provide your feedback. As I mentioned, your feedback provides us valuable insight into how we might improve these webinars, potential discussion topics, and to ensure that these webinars continue to benefit everyone. Thank you so much and have a great afternoon.